Hello, welcome to week 12 assignment communication 205. This week is a week about the speech project delivery. My name is Sylvia Natalie Wenholm, and I'm going to present you my topic for this week. The topic is titled Only Patients Have Right. According to James, according to James Merlino, we are in the ultimate customer service business. There is nothing more personal or service-oriented than healthcare. So, like in the general business, the patient are considered like customer. Like customer need always have right. That's what they used to you. They always say. And in this specific case, I'm gonna use the patient, and like my topic says, is only patient have right. The definition of patient first. So to define patient, patients are considered as beneficiary of healthcare services performed by healthcare specialists and medical doctor or physician, nurses, psychologists, dentists, veterinarian, nursing assistants, caregiver, home health aide, or any other healthcare provider. Patients are people who are sometimes unhealthy and require physical or psychological assistance and care. Patient and the healthcare provider team are in constant and crucial relationship and need to communicate each other either verbally or non-verbally. Because of their vulnerability, patient healthiness need to be met, and that is their right. So those rights are manifested by their priority and their centered care. Patient-centered care is summarized as nothing about me without me, according to Sacristan. However, it's only patients who are supposed to have right all the time. That is a question. What about the healthcare provider who are abused and harassed by patients and can't defend themselves? So the first point here is going to be focus on the patient-centered care. The importance of understanding patient having rights in the healthcare system is based on the evidence-based practice. That evidence-based practice allows patients to decide in their care and provide opinion regarding their well-being, communicate their value and preference, and also making sure that the recommendation, the way they want their care to be proceed, should be respected in their convenience. In that case, patients have the right to receive good quality of care and to be taken care of in any situation. Patients then have all the right they need to be healthy. The other point here is going to be the communication between the patient and the healthcare provider. That is considered like they call it, is usually called interpersonal relationship between patient and healthcare provider. When a communicative relationship is established, feelings, opinions, ideas, value, and belief are exchanged through verbal and non-verbal communication channel in the hope of achieving some sort of share. So that is according to Tal. In some sequences, especially during care administered, the meaning of the message sent can be misinterpreted either by the patient or by the healthcare professional. By the healthcare professional will provide the care. Cultural difference can lead to misunderstanding too. So there is a need for mutual respect and understanding of verbal and non-verbal communication for a good interpersonal relationship. One of the most example about the verbal and non-verbal in the interpersonal relationship is sometimes some patients, while they are home, they used to take their medication at, at a specific time. So when they go to the hospital, they have over there they have a different schedule about their medication. And now when they are sent to the nursing home, for example, by the time they used to take the medication comes, and they don't see the nurse bringing the medication, they interpret that like the nurse doesn't want to give them their medication. And in that case, they will sometimes call the nurse and ask the nurse to give them that specific medication. The, if the nurse just explained that, I'm sorry, at this time, your medication is not scheduled. Please, can you wait and take it at the scheduled time? The patient will take that answer like like the nurse refused to administer that medication. And that will go on and on. And the next, they're gonna report it to the administration. And at that point, the administration would believe the patient because the patient is the one who have all the right at that point. When it happened like that, the nurse is gonna be sent home, and the investigation is gonna start to find out the reason why the patient accuses the nurse. So after investigation, they will find the truth. And sometimes they will call the nurse back. So that lead to the vulnerability in the relationship between patient and the healthcare provider. And that is our third point. So the vulnerability in the relationship between the patient and the healthcare provider is usually a health issue, in the healthcare issue. So patients regarding their health issue are vulnerable due to their health issue, putting them in a position of dependency toward healthcare providers. Also, healthcare providers are vulnerable in some situations during care to patients. The reason is that sometimes patients use their position to abuse the healthcare provider. So the abuse can be like they can say some abuse word to the healthcare provider and use their situation to cover themselves. And at that point, the healthcare provider cannot complain. And sometimes if they complain, they will just say, okay, that's fine. It's only the patient. You need to understand that that's how maybe it doesn't feel well. That's why I said that. But they don't take into consideration how the healthcare provider feel. So in conclusion, upon our work now, we realize that patients are not always right. Patient can be first, but not always right. Patient can be the priority, but not only right. Also, when it comes to the interrelationship between patient and healthcare provider, there is a need for a certain equilibrium. Some patients are the first to offend healthcare personnel who provide them with care, Healthcare providers are not always taken into consideration in that case, and most of them are sometimes fired because of the patient liars, and that is unfair. So our suggestion at the end of our topic is that patient don't need to be the only person having right, but both patient and healthcare provider need to be taken into consideration and having the same opportunity and right because they both suffer the same. Thank you.